I'm Dr. Arjun Handa, plastic surgeon at Handa Aesthetics and Plastics. Buttock augmentation is one of the most common procedure that I do. When patients come into my office, they usually ask, is fat grafting the only option? Is there any other option by which we can increase the size of our butt? Well, butt implant is another option. So the choice is between fat grafting and butt implant. Butt fat grafting is also known as Brazilian butt lift. In this video, I'm going to talk about certain factors which play a role in making the decision between the two procedures. Let's start with butt fat grafting. The butt fat grafting is a procedure in which we take the fat from the tummy, lower back, thighs, and then put it into the buttocks to increase the size. It is the gold standard procedure of buttock augmentation, which means that it is the most common procedure performed and the safest procedure with minimal incidence of complications when it comes to buttock fat grafting. However, there are certain complications and risks associated with the procedure which can come down if done at the right place in the right technique following the right guidelines. One of the most common complication and most important is fat embolism, in which when the fat is injected into the buttocks, sometimes inaccurately it is injected into one of the large blood vessels through which the fat can travel and go to the lungs or the heart, causing cardiopulmonary compromise. This can lead to serious complications which can lead to prolonged hospital stay and even death. Citing this complication, current guidelines state that the fat is not to be put into the buttock muscle but only in the space below the skin in the fat plane. This plane is safe, and with huge numbers of cases being done already by us, no complication of fat embolism has ever been reported. So, if the correct guideline is followed, then fat embolism in all probability does not happen, and that is why this procedure has become very, very popular. The second complication that can occur with butt fat grafting is fat necrosis. When we put fat into the buttocks, we have taken it away from its blood supply in the abdomen, in the lower back and in the thigh, and then we have put it into the buttock where it has to take on a new source of blood supply. If a large collection of fat or a certain portion of fat that we have put is not able to take on the new blood supply, it dies. And that is known as fat necrosis. This fat necrosis sometimes goes unnoticed because it is absorbed by the body. Sometimes it forms a large lakes inside the buttocks which then burst out and come out as liquefied fat. And sometimes it can get calcified to form hard swellings. I cannot discuss the treatment of these complications here because that would be another video. But all I can say is that if correct technique of fat grafting is followed, in which small pockets of fat are deposited at irregular intervals in different planes, then the fat can easily take on the blood supply and this complication is mitigated. So it's very important for the correct technique to be followed to avoid this complication. Fat embolism can be prevented by correct technique and following the correct guidelines. Fat necrosis can be avoided by following the correct technique of surgery. Another complication of fat grafting can be asymmetry. Sometimes more fat is taken on one side and less fat is taken on the other side, which can cause one buttock to look larger and the other smaller. If it's a minor difference, then it may go unnoticed and the patient may not be bothered about it. On the other hand, if the difference is large, then it obviously becomes very, very evident, and then it has to be corrected in a second procedure. This complication is avoided by knowing the characteristics of the fat, which fat to put in the body and which fat to discard, and the preparation of the fat and the technique of grafting. This complication usually does not happen with doctors or plastic surgeons who have done this procedure repeatedly and have a considerable experience. This complication is normally seen in novice plastic surgeons or amateurs who have just done a few cases. So if you are choosing a plastic surgeon who is probably experienced, then this complication is a less likely outcome. Another complication which is very unlikely with buttock fat grafting is infection, because this procedure is normally done in institutions with a large support system where sterile techniques are followed to the letter. Next we come to butt implants. If buttock fat grafting is the gold standard, why do we even consider buttock implants? So the answer is that in some patients there is just not enough fat. If a patient comes to me with body mass index of 18 and less, where there is hardly any fat in the body, there is no other option but to choose buttock implants for them. Even though buttock fat grafting is the better option, butt implants will be the option in these patients because of the lack of fat in their body. So what are the complications associated with buttock implants? Number one is infection. Whenever we are putting an implant anywhere in the body, the most dreaded complication is always going to be infection, because usually this infection spreads very rapidly due to the presence of a foreign body, and antibiotics are unresponsive in these cases. So the only option left at the end is to take out the implant, and the surgery is a failure, which can be again repeated after 6 months to 1 year, but the patient has to be subjected to another procedure, and the complications that have already occurred and the patient has suffered add to the grievance. If the buttock implants are put in an institution where sterile techniques are followed, then usually no infection happens. The second complication is extrusion of the implant. This is a consequence of infection, and sometimes the sutures just give away if the implant that has been put has not been placed correctly, or the sutures are placed under tension. Eventually they break down and the implant is exposed, it catches on an infection and has to be taken out. The third very common complication of buttock implant is displacement. The buttock muscle, that is the gluteus maximus, is the largest muscle in the body. It is a very strong muscle. So if the implant is not placed correctly, the forces acting in the buttock are very strong and they can displace the implant from its position. Most commonly, the implant travels inferiorly into the thigh or around the buttock on the side of the thigh into the hip area. So to prevent this complication, these days we put the implant inside 2 layers of the muscle, so that when the muscle contracts, it keeps the implant in its place. This is where the technique of plastic surgeon comes into play, because if he has placed the implant correctly, then the implant is not going to get displaced for a long period of time, and eventually it's never going to get displaced. Finally, we can talk about the need for another surgery. Sometimes after buttock fat grafting, there might be another session required because the size augmented may not be sufficient for the patient. In case of butt implants, this decision is made preoperatively, so the chances of this happening are usually low. Chances of this happening after buttock implants is low, because the implant has been chosen preoperatively, the results are reliable, and the size estimated is what the size that the patient is going to get in the post-operative period, and there is no problem like fat resorption or fat necrosis that can occur with butt fat graft. So these are some of the points that a patient has to take into consideration, and a plastic surgeon should explain to a patient looking for buttock augmentation. Please like our video. If you have any questions, please mention them in the comment section below and subscribe to our channel.